100 million Americans are living with undiagnosed chronic conditions, and nearly 1 million people die every year of preventable causes. We're building the world's best AI doctor powered by real doctors. I think the problem really is we're spending $5 trillion a year on healthcare in America, which, by the way, is more than the entire GDP of the country of India, and yet the outcomes are really, really bad. So we built a product that is centered around the patient and gives the patient what they need in a timely fashion. And the problem today is because care is so inaccessible and expensive, people just sort of delay care. Primary care was really the solution to the problem, and going direct to the patient we thought was the best approach to solve that problem.
Most healthcare innovation is provider and payer first. Why did you decide to go after the patient first?
A lot of the innovation happens for providers and payers because they pay the most, but also because patients aren't usually in that sort of trifecta of a system. So we thought the best way to actually solve the problem was to cut out all the noise and build a product that the patient uses directly, because we don't have enough doctors. And so we can't just magically create more doctors, right? It takes over 10 years of training. So that's really where we think technology, and especially with the advent of AI now, we can really bring the cost of care down. We've basically built our systems on the back end to help clinicians be 10 times more productive.
You described Lotus as the power of 1,000 clinicians in your pocket. For someone who's not yet familiar with Lotus, could you describe what that actually looks and feels like in your day-to-day once you've connected your wearables and insurance information and everything else?
It's like opening an app and getting the best possible medical advice. Being able to talk to Lotus and be confident that it understands your entire health history. So the answers that it's giving you are grounded in not only just your entire health history, but also the latest evidence and medical research and the latest clinical guidelines. We like to always say that we're building the world's best AI doctor powered by real doctors.
And you're already seeing many patients today. They're having great experiences. Can you share more about what you've learned about what a modern primary care experience should look like from the early patients that you've been working with?
Yeah, absolutely. For example, one of our patients, she was misdiagnosed for 35 years with lupus. And hours after becoming a Lotus patient, Lotus was able to flag to one of our clinicians that she might have MCAS and not lupus. And so our clinicians recommended she tried over-the-counter medication, and the next day she was better after 35 years of suffering. And it also found in her medical records conditions that the doctors didn't have time to explain to her. She never knew she had a peptic ulcer during a hospital visit that she had. Lotus was able to surface that to her, and that was something that she could sort of research and learn more about and take care of herself at home. Things like that are really already transforming lives with Lotus.
You describe Lotus as a movement, not an app. How do your values show up in the product, in the AI, how you work with clinicians, in the trust and the privacy of your patient data?
Yeah, that's a great question. Privacy and trust is foundational to what we're doing because we're dealing with very sensitive data, and patients really have a voice now that they've never had in healthcare. So Lotus can talk to you for hours and really deeply understand you. And so you as a patient are finally confident that you are being heard. The other thing that we've been doing, and this is from the beginning, and Annie, you've met with some of these clinicians as well, is we built a very strong clinical advisory board of medical doctors from Stanford, Harvard, and UCSF that have really been there from day one, and they've helped us design the product in a way that focuses on patient care. So all of that combined really moves it from being an app to a trusted relationship.